All right, thank you, Zach. All right, thank you everybody for joining us today. I'm Russ Nichols, the CIO in California at California Department of Corrections, and also the current president of Corrections Technology Association. Thank you for joining us this week. This is the second of the webinars that we've presented related to the COVID-19 health emergency that we have going on globally. And I say globally today because I know we have a couple of folks joining us from overseas. So I will pull a couple of them into the conversation as we go through to get their input on what they're seeing specifically in Europe and ask for that. So as we jump in, I will do that at a different point in the conversation. So again, thank you for joining us. Just a couple of pieces of meeting hygiene. If everybody could please remember to mute your phone lines. Just to cut out the background noise. And if you have questions, to the extent that we can, go ahead and type those into the chat box on WebEx interface, and we will have a couple of folks going through those questions, trying to in front of us so that we can address them. That way we don't have 100 people trying to speak at the same time. If there are folks that do not have that ability, towards the end, if we've got some time, we will open it up for verbal questions, but to the extent possible, let's use the chat box for that. All right, other pieces of this meeting hygiene. As much as anything, we want to share ideas, share challenges. What are we doing? What have we learned so far? We will be posting this out on the CTA website as we record it. So that'll be out there. The session from the last session that we did should be out there shortly, if it's not already. I know the recording has been completed and will be posted either on the COVID-19 page under CTA or might right now be in the CTA TV section of the website. But we'll get that posted so it's easy for everybody to get to. We'll do the same thing with this one. As far as other comments about the webinar conduct itself, obviously we want to talk about the things that we're doing. We're not trying to specifically endorse one product over another. We also specifically do not want to bash any product. So if somebody is struggling with something, not a time to throw a vendor under the bus, but it is fair to talk about some of the struggles we're having. So just be cognizant of that, and as we go through this, we'll try to keep this as open and community-based as possible as we have these conversations. So with that, the group that's bringing this to you, the CTA Board of Directors, as I mentioned, I'm Russ Nichols, I'm the president. I have Zach Allen, who is the marketing director for CTA, also the CIO for the Virginia Department of Corrections online with me, helping to facilitate today. Jerry Brinegar is in New Mexico, CIO of the Department of Corrections there, and he will also be presenting as we go through today. We'll do this one a little differently. We're trying to set these up more as a panel rather than Russ as the talking head. So we'll bounce back and forth a little bit, but overall the conduct will be the same. We'll try to capture questions on the fly and address them as we go through the slide deck. So with that, let me jump right in. These are the topics we have on slate for today. We will try to leave some time open for open topics. So if you have some ideas at the end, please go ahead and send those in through the chat box, and we'll see if we can add those. We'll take some notes and see if we can address any questions or topics that come up. Or expansions on some of the topics that we've hit. So what you see on the slide right now, we'll talk about the use of video conferencing, telework, some HIPAA concerns, remote meeting solutions. At the very end, I'll speak a little bit about the 2020 summit that we have planned for St. Louis this summer. So with that, we'll jump right in. Jerry, if you want to, I'll keep the slide deck, but if you want to jump into this topic, video conferencing for court hearings and what you're doing in New Mexico.
Sure. Can you hear me okay?
Yes.
All right. Yeah. Thanks, and good afternoon, everyone. But before I specifically talk about court hearings for us, I'd like to segue into that, starting with our parole hearings. So in New Mexico, we have been hosting video conferences for parole hearings for over a decade. We accomplish that through an conferencing system that rides on our network. The parole board in New Mexico is its own entity here, but is tied to corrections. So they do utilize our systems and are also on our network. So being that they are within our network, this has been a fairly easy process for parole hearings. For court hearings, on the other hand, up until now, we've handled through in-person court transports, which may, I'm assuming, also be the norm for many of your jurisdictions as well prior to COVID-19. And also, as I'm sure as with each of you guys, business process changes are evolving daily in response to coronavirus-19. So about 2 weeks ago, we started routing all of our out-to-court inmates from facilities back to our centers, regardless of where they're being sent from. So, and the thought process here is that they could be better screened by more medical staff that happen to be in those locations. So I probably don't need to say this became extremely difficult to manage, both due to the increased threats and exposure to, inmates, not to mention the bed management nightmare that it created. As a result, after about a week, we then started stating that any out-to-court transports that couldn't be postponed would result in the inmate staying at county. As you can imagine, this also did not work, and we needed to come up with a systematic plan. So as it happened, we had already selected an off-the-shelf conferencing solution to handle inmate video visitation, at least in the short term, which is Google's G Suite Meet. And through conversation, we learned that the courts were also starting to utilize that software suite. So after we had a few discussions and some testing, we are at this point scheduling video court hearings for as early as next week. So on the slide, as listed, video court hearings obviously improves public safety, inmate safety, and staff safety through a distancing approach, as well as reducing costs and increasing flexibility. So that's what we're doing right now for court hearings. I'd like to open it up at this point for jurisdictions and what they're doing for video.
All right. Zach, are you seeing any questions come in on that one right now?
I am not seeing any other questions coming in.
Okay.
What is the name of the NM Court SW?
There is a question. What is the name of the New Mexico Court software? I think it is. It's shortened, but I think that's what they're asking.
Yeah. So again, that is Google G Suite, and we're using part of that suite called Hangout Meets.
All right. Thank you, Jerry. All right. Any other questions on that? We'll delay just for a second as. Okay. Not hearing any. All right. We'll jump off to the next topic. I imagine a lot of folks are looking at video conferencing for court hearings. We have some CTA sponsors. There are vendors out there that specifically do video arraignments, type of things along those lines. So I suspect this is a very popular topic or in use by a lot of us. We're doing the same thing. We're doing something very similar to Jerry here in California, but we're using essentially our own network and extending through Skype type sessions into the courtrooms here in California. So with that, let's move on to the second item on the agenda for today, and it's all talking about telework. So in the last few weeks in California, we have gone from an agency that by and large did not support telework to turn that model upside down and trying to make everybody that possibly can telework. So Zach is going to talk to us a little bit about the situation and what they've done in Virginia.
Yeah, so I can imagine that a lot of people on this webinar have had a challenge with this. What we've experienced here in Virginia, and we have a centralized IT that takes care of pretty much power, ping, and pipe. and then the DOC's IT unit takes care of the rest. What we saw is a massive influx of people trying to use our VPN concentrator. And this is all executive branch agencies going through the VPN concentrator. We had a capacity prior to the COVID-19 outbreak of, I want to say, around 3,000 to 5,000 concurrent users on our VPN concentrator. And then when the COVID-19 went into effect, and we have 106,000 state employees in Virginia, that usage exponentially increased. So what we call VITA, the Virginia Information Technology Agency, had to really play catch up here and start really putting in more hardware to support the VPN. They had to procure more licensing, and they've been upgrading, gosh, it seems like once a week now. And we continue to have outages almost daily with our VPN. And so what we have done at the Virginia Department of Corrections, working with our centralized IT agency, is we started piloting a software called Zscaler. And Zscaler is more of a tunneling. It is not necessarily a truly VPN solution, but it is a tunnel, which is an encrypted tunnel to your network resources. And we actually started implementing that this morning in a large pilot group here. And what this will allow us to do when it goes fully operational, and by the way, the pilot went extremely well and extremely easy, is we'll be able to bypass the VPN now and take, because we're the largest agency in Virginia with 12,000 employees, and we'll be able to bypass the VPN now, having our own solution stood up to be able to get access to our network resources, and then allow the other executive branch agencies to really use the VPN. So that's what we've been doing with the allowing us to connect to our network. And there's other challenges that come with teleworking that we've seen. IT obviously has been, and I'm sure this goes with a lot of cases with a lot of folks out there, IT is pretty versed in telework. We've been doing it for years. We've been doing teleconferencing for years. We've been doing a lot of things from home for years. A lot of our folks within corrections and jails have not been doing that for years. And there is a unique challenge that comes with that. Let's take something very basic, teleconferencing etiquette. We noticed right from the get-go that there was no concept of dressing appropriately for teleconferencing. There was no concept of muting your line and then having the children run around in the background. There was no concept of making sure that if you're going to use the camera, to make sure it's appropriately pointed to you and not off to, a wall or a flower or whatever else it was pointed to. So there's a lot of things. People were eating on teleconferencing, those sorts of things. So what we did in Virginia in my group is we put out communications to our entire agency to really work through teleconferencing etiquette, basic things on how to do teleconferencing over the phone, how to forward your phone. So we thought that those, and then we sent out very specific directions on the teleconferencing software that we employ within the Virginia Department of Corrections, like WebEx, Google Hangouts, those sorts of things. We had to put out specific directions on how to use that software because many of our staff members had never used that software. So just a lot of challenges with just teleworking in general. And I would ask my deputy CIO is on as well, and I would ask Felicia if she has anything to add to that. Please go ahead. And if she doesn't speak up, that means she doesn't want to add anything. So I'll open it up to anyone else, Russ, who would like to speak on the topic.
All right. So I'll give you a little insight. I may have spoken some of this last time we got together. What we're doing in California, we have been predominantly a VPN-based organization until recently. We did use infrastructure, but we were very dependent on laptops. So we hand staff members a laptop, and that has been our mechanism in the past for accessing our systems. When we've really changed the model a little bit, so we now go out and really interact with the lines of business and ask them a couple of questions. First one is, do you actually need a laptop to do your job? For staff that actually need that device because they're mobile, they're going site to site, they need to be able to have something physical that allows them to do that. Laptop and VPN connection is still what we are doing, and we have over 6,000 staff with laptops in the department, and we see concurrently connected about 4,000 of them at a time doing that. What we've really stood up recently and started to double down on is VDI. So if staff members actually have their own personal computer and internet connection at home, rather than waiting for us to procure more laptops, we're setting up with a infrastructure solution and the ability then to run a remote session on their desktop that's at the office and continue to work that way. And that's actually worked out very well for us. Literally just spun that up over the last 2 weeks in bigger than in production mode for anybody in the department that needs to have access. And we're literally adding hundreds of people a day to do that. And then the other thing that we're leveraging quite a bit is the Office 365 suite. So people working at home, they really just need email to do their transactions, to keep in communication with the department, is also being used quite extensively within our organization. So I'll pause there. Did we get questions?
Okay. So I'll just say it. We've got Jerry who's just commenting that we expect the same in New Mexico. Within our instructions and handholding, some of these individuals that will man inmate video stations have never utilized a computer at the facility. He also says in New Mexico, we doubled our number of concurrent licenses, but are at a limit based on hardware. They're likely going to need to replace that infrastructure. And New Mexico Department of Corrections is currently using Pulse Secure VPN for telework initiatives, strictly utilizing NMCD equipment with no BYOD allowed. Once users are authenticated, they conduct RDP sessions to their in-office workstations.
One of the things that I'm sure a lot of people are seeing is licensing constraints. In California, our vendors have been working with us very collaboratively, and essentially we've established true-up mechanisms. So we may have a license limit of 5,000 on a client. They've given us the authorization, actually given us licensing packs to blow well past that, and then true up at the end. So we'll follow up with a PO and actually fill the books in the future. And we've done that with a number of our products. So if you have not done that, and it's a licensing constraint, not a physical hardware constraint, that is an option you should explore.
Rich asks, Russ, are you using Teams as part of O365?
We are actually a little behind on the implementation of Teams. We're still using Skype for Business. So we're using the older version of the client, but we are leveraging it a lot. Just for my team meetings, but also across the entire department and for meetings that cross the boundary outside. So we're using Skype, actually, I mentioned a little while ago, with some of the interactions with the counties and things along those lines. We're using it in our effort with our border parole hearings and a number of other areas. So Skype is our primary client. One of the reasons, and actually we'll talk about some of these clients actually on another slide, so I'll come back to this in a bit, but we have not really adopted Teams yet in California. All right. All right.
I'll say this, Russ, just to add another thing in here. I know that Zoom is a very popular platform for teleconferencing. But we've been getting a lot of reports recently of Zoom having some security vulnerabilities. There's a concept called Zoom bombing now, which has happened quite a bit here recently, where they can infiltrate a teleconference that's going on. It's happened at a university recently. It's happened at a state teleconference recently, where somebody will get in and be able to take over and show pornographic pictures and do inappropriate things. And I know that Zoom is taking a better posture with security since in light of these things recently coming out. But yeah, we just heard some not so good things about the platform Zoom here recently.
Right. We can dig into sorry, feedback there, obviously. We can dig into that a little bit more at the end of the webinar as we talk about some of the platforms that are available.
Chat comment. Travis says in SC, we have been using PulseSecure for VPN and VMware Horizon VDI for remote access, but are limited in the number of sessions by licensing and hardware. We've been working with Microsoft to provision Windows virtual desktops as a more scalable alternative.
Thank you. All right, so we'll move on to the next question or the next topic, which is around HIPAA concerns. So as we are all looking at how to extend our services using virtual tools or technology, medical interactions is one of the primary areas where there's a bunch of demand for that. A number of jurisdictions have really invested in telemedicine technology over the last few years, California being one of them. Jerry, I'm going to hand it off to you and talk a little bit about the telemedicine that you're using in New Mexico, and then open the floor for some other guidance. And I was actually pointed at a document that I may be able to show on the screen, or at least tell people about, from Health and Human Services with some guidance on this topic. So Jerry, it's up to you.
So as I mentioned earlier, our video conferencing solution that we use on our internal network, in addition to parole hearings, we are also utilizing that for a variety of telehealth, telemedicine, telepsychiatry. We manage those provider endpoints within a DMZ through a number of different methods. Some of those include dedicated circuits, point-to-point calls via IP addressing that go directly to doctors' home units. We also have a conference bridge available on our website, which allows approved connections via browser and smartphone. So again, security, because it's all within our network, it's more contained. But the question here is, how can we ensure HIPAA compliance to eliminate potential violations in the telehealth area, particularly if it's not within your network? Zach, already mentioned Zoom bombing that I've been reading about, and there could be other potential threats utilizing off-the-shelf conferencing. I think we're talking about some of this on the next slide as well. I will say that the Google G that we are utilizing does provide a HIPAA compliance feature, but it requires us to sign what's called a Business Associate Agreement, or BAA, which our agency has not done yet. Russ, I think the document that you're talking about is the one that was forwarded just a bit ago that you're going to try to either, if not share on this screen, forward via listserv or some other method for individuals to have an opportunity to take a look at that. So in general, I mean, all of these off-the-shelf products, don't really have corrections in mind necessarily. So as we're going through some of the things that we're doing for meets, for audio and video, although they do have encryption, we're having to go through like all of the functionality with a fine-tooth comb, and like for a video session, making sure that we can't do instant messaging at the same time, or disabling call options so that you can't have audio happening through a phone call, so that we're forcing audio and video to run through the meet session and not via phone.
Okay. And Jerry, you're correct. I'm looking at the document. It's a document that comes out from the U.S. Department of Health and Human Rights, or Human Services, Office of Civil Rights. And it's a frequently asked questions document about telehealth specifically and HIPAA during the COVID-19 national public health emergency. And so in that document, it gives some guidance, and even down to the level of some of the products that are good to use and should be avoided. It does talk about some of the HIPAA regulations that are essentially relaxed during the course of the emergency. Not that the actual statute behind HIPAA has changed, but an acknowledgement that we now have social distancing and stay-at-home orders that would prohibit normal operations. And so really what it says is apply due diligence, do the best that you can, but there will be instances where, for example, a clinician would have medical information potentially in their home as they're conducting a session, which would not necessarily be normal. But in this extenuating circumstances, they realize that, and people will not be essentially fined or have enforcement action based on HIPAA law in that type of a situation. It does speak specifically to some tools and using essentially closed systems to conduct telehealth type of interactions. And so tools like we're using today, WebEx, Skype for Business, things along those lines are closed systems, as opposed to things like Apple FaceTime or Facebook Messenger, Facebook Live sessions, things that are out for general public, easy for other people to join in. You would not want to use those for telemedicine, telehealth type of interactions. So that document, actually, the way I'm set up, I'm having a hard time figuring out if I could get that on my screen without potentially ending the whole session. So I'm not going to do that. But we will post a link to it on the CTA website. We just created a COVID-19 area on the website. So we'll post this link, if not the document itself. Actually, we'll probably post a link in case the document is modified. That way you actually go to the source to pull that up. But we'll try to get that posted as quickly as possible. Jerry, anything else you want to address on that? If not, we can open it up for some questions related to telemedicine and HIPAA.
I don't. I wanted to make sure that we give Virginia an opportunity to speak to it as well.
Yeah, I just wanted to briefly mention, I'll let Jay chime in here in just a few minutes, is that the Office of Civil Rights and HHS has relaxed some HIPAA rules, allowing FaceTime, Zoom, ironically Zoom, and other forms of communication to do telemedicine. Jay, are you on, and can you add any to this subject?
Yes, sir. This is Jay. Are you able to hear me?
Yes.
All right. So what we have at our location, we're using Polycom as our base method of communication. It is a closed system. It's handled on our network. And what we do is we have video units that are at the specific facilities. We call them telemed units, of course. And they are used for our telemed from hospitals. We have a circuit at Virginia Commonwealth University. We also have one at UVA that allows for providers to be able to connect directly. In these times, however, there is the expansion of that into using something that is available via mobile, which is Real Presence mobile app. And what we do on our side is we create a virtual meeting room for the providers, and then the providers are then able to contact the facilities, and the nurses and the staff at the facilities are then able to dial into the same room, and therefore they are able to schedule and conduct those interviews at a specific time and in a secure environment. So that's just one of the ways that we have been able to do that. We also do that for telehealth. We also do it for telepsych and telebehavioral health, because of our reentry group also uses that for crisis times for our reentry patients.
Thank you, Jay.
All right. I would add that in California, and I'll use a specific example, prior to release of some of our high-risk offenders, we have mental health staff that actually do an evaluation. That interview obviously is HIPAA related information, and so we try to be very careful with that. Now with the social distancing and frankly trying to not have people travel across the state to conduct those interviews, we are putting an offender in a room speaking with a mental health professional who could be halfway across the state. In California's example, we use a Cisco device in the room with the offender because it is a very secure device. It's not like a PC or some other device that the offender, frankly, could manipulate or use to do something else. And then we run that across Polycom Bridge out essentially to a Skype session that is being used by the mental health staff member. So there are a bunch of tools in there. That's just a specific example of the way we're doing it. And again, that document from Health and Human Services will list some of the other tools that folks are using. The one thing I would counsel, though, in our experience doing this in California, is make sure there's either an appropriate staff member in the room or with eyesight into the room, if not in the room because of HIPAA concerns, to ensure that the end user device that is in front of the offender doesn't become a tool for other activities, communicating outside in an uncontrolled manner. All right. Questions?
Yes. So a comment from Terry Wilshire to everybody with regards to video visitation solutions. Terry can help with any questions on this topic. This method can be used to solve issues with allowing secure, privileged communication with public defenders and paid attorneys. So if you have questions, reach out to Terry Wilshire. Terry also says on this subject of video visitation and design workflows with privilege level access could be used as well, closed system. And Stephen says, I don't know if this is the topic, but has anyone experienced with thermal images or other tools to check temperatures of staff, visitors, and inmates for fever?
Let me hold that one and come to that as we move forward in the webinar, because I do think that's a great question. We can spend some time on it. All right. All right, with that, we'll move on to the next topic. We've actually hit this a little bit already as we talk about some remote meeting solutions. And to a point that Zach mentioned a few minutes ago, is these products are developed, a lot of times they are not developed with a correctional environment in mind. And so what that means is we have to go in with a fine-tooth comb and look for the good and the bad. And the question on the slide that you see in front of you, is there a best? And I think adamantly, I would say the answer to that is no. There might be a most appropriate for the particular jurisdiction or situation that you're in, but based on licensing, based on type of communications, and frankly, who's using it, the expertise or experience of the end users, you could be all over the map. Zoom is obviously taking a little bit of a hit right now, but frankly, these are unprecedented times. They're being hit with things that one, capacity side, they never anticipated blowing up to this level within the last few weeks. And now that they are in such demand, frankly, the bad guys are out there trying to mess with it. And so Zoom happens to be the target this week. Next week, it could be Skype or WebEx or other vendors. So Zoom has made a very public statement that they are working to improve their product and to lock down some of these areas. But I would not sit here and recommend one over the other. We happen to use a lot of WebEx and a lot of Skype for Business, primarily Skype for Business in California. But we do not have a prohibition on some of the others. We do suggest against some of them, primarily because of network bandwidth. Product Skype for Business, for example, allows us to really control the portion of our wide area network that's consumed with the video, as opposed to some of the others, which will try to consume the entire bandwidth if allowed. So let me pause there. Zach, I know you've had some experience specifically with this. Do you want to speak on this topic, or Jerry, do you have some other thoughts?
Yeah, Russ, I actually had a question for you. Do you all use Microsoft Teams to facilitate any of this?
So we're not, yeah, we're using Skype for Business in particular. We've not migrated to the Teams product yet, not because of any knowledge of a problem with Teams. It's just driving a battleship the size of California. Turning that corner is a slow process. So we've been very successful with Skype for Business and anticipate moving to Teams. We're just not there yet.
Okay, because what we were thinking about moving to Teams as well, but we found out that you had to really be connected into SharePoint as well to use the platform. And unfortunately, at this time, we're not connected to SharePoint. So I was wondering if you knew if that was a legitimate limitation, if you didn't have the SharePoint 365 platform, that Microsoft Teams was really off the plate until you connected to that platform.
I'm sure we have somebody online who can speak with more authority on this topic than me. I lost my engineer credentials a long time ago when I moved into this.
So have I. I will say this, that Virginia is using a lot of Google Hangouts right now and Google Meet because we do use Gmail. And so that naturally fits into our platform. Our go-to outside of that is WebEx. We have been authorized to use Zoom from our centralized IT agency. However, in light of the recent circumstances, I have postponed that for now. So that's kind of what we're using here in Virginia.
Thanks, Zach. In California, we are predominantly, sorry, my coffee hasn't kicked in, Microsoft-based. So we use Office 365 in exchange for our email system for the entire state, and predominantly use, again, Skype for Business. We use SharePoint quite a bit, and so that's the reason I don't know if it's actually a requirement. I believe there is. But since we are using Skype, we haven't hit that as a barrier for us. I'm sorry, since we are using SharePoint.
Lucas commented that Vermont has decided Skype for Business is what they will be using for HIPAA-related video needs, but they have been transitioning to Teams for other video conferencing needs.
Thank you, Lucas. All right, and Rich, I don't know if you can unmute. It sounded like you may have some direct input on that.
Rich just put up something in the chat. Yes, we're using Teams at San Diego Sheriff. We'll also have SharePoint. We also have SharePoint, and my understanding is that it is indeed required and it's working fine. This is comment.
All right, thank you.
Yeah, Zach, I was just going to say this is Jerry, that we have also not moved to Teams, kind of for the same reason that Russ stated. But I didn't know it was required, but I knew that the way that the licensing was bundled as far as different governmental levels, that those do seem to be bundled in the same thing. I think it's G3. That may be an incorrect level, but that you see those things bundled together. So.
Yeah. All right. Thank you, Jerry. All right. Before I even move on to the next slide, we're actually coming to the end of the topics that we had scheduled. But let me put a gentleman from Belgium on the hot seat and see if he's able to join us with audio and speak to us for a moment. So Hans Murie, I'm going to murder your last name, Hans, I apologize. Maurice is the former Director General of the Belgium prison system. And I had the pleasure of meeting Hans at an ICPA, an International Corrections Prison Association meeting last year. Hans, are you able to get audio? And maybe not. So Hans is actually in Europe and obviously a few hours ahead. In fact, I think it's pushing.
Yes.
There we go. Yes.
Yes. Hello there. I'm from Belgium. Maybe some of you know also Steven van der Steen, who's also a board member from ICPA. So very short up from Europe. Well, we have a lot of contaminations with staff and inmates everywhere in Europe. You have seen the pictures of Italy and Spain, but now corrections is hit very hard everywhere. So we had some webinars to discuss solutions in corrections in Europe. First of all, to maintain calm, we usually give access to telephones. A lot of systems in Europe, like Belgium, France, have installed telephones in each cell. So each inmate in Belgium and France has access to an individual telephone. So that's for one. Second thing, due to COVID, because there's no visits or separated visits, we have discussed, and I know this is really typical, I think, European. Each inmate got €5 for free to make phone calls, just to maintain contact with his families. For the rest, we have separated, let's say, wings, where we have to concentrate a lot of these inmates. So due to all these situations, we went in a very accelerated way to telework for staff. From head offices, only a few people on head offices. Most of them work from home. That's for us a revolution in corrections. It's never been done that there is a lot of telework possible in corrections, but it is now. For the courts and all kind of hearings, we have used Cisco technology in all Belgian prisons now. We have video conferencing rooms installed. In a week time, it's possible. There was no money, now it's possible. So we have limited transports from inmates to nearly zero. So we just are trying to share information about all measures to take, but also about technology by contacting everybody all the time. So we are just now thinking what will be after COVID. There will be a huge acceleration to more technology for all kinds of solutions. This is very shortly, I think, the conclusion of what will come to us. So we are looking forward with our future program committee, and Russ, we saw you in Porto and Chris in last year. So I think the next TIC conference, which will be normally organized in Dublin in May next year, we will have shortly half a day of huge discussions and learning platforms about how to handle a crisis and what is the aim of technology in 2021 and future. So that's my contribution to this webinar, Russ.
Sorry, I need to take the phone off mute before I start talking. So thank you, Hans. I really appreciate the contribution. We're seeing a lot of things or doing a lot of the same things that you referenced there in Belgium. Steven van der Steen, are you on the line as well?
Yes, hello everyone. Yes, I'm on the line as well. So Hans has told a little bit the main things that intervention we take, and I think, as you said, Russ, it's similar to what you are doing. We are currently with ICPA looking to help not only the countries in Europe and then the US, but also at this moment there is a webinar going on with South America. So we are really looking into helping each other globally on this. So maybe an open question to you, to CTA and all the participants. We probably in the upcoming days will have questions from all over the world on how to deal with technology, and some of them can be very practical, like we just meant in the discussion about the difference of different technologies and so on. So my open question to you is could you help us, and could we reach out to you if we have some questions like this?
Absolutely.
Okay, and then I will share also the website of ICPA, where we have it's more generic information globally on the intervention and the initiatives we take to tackle the impact of COVID-19 in corrections globally. So I share this website with you. It's not of course dedicated to technology, but there are some interesting things, I think, for you and also to share with your non-technology colleagues in the different jurisdictions. So thank you for this webinar. It's really interesting, and yeah, I still have my questions about thermal imaging, because apparently this is also a question that comes everywhere in the world. How can we easily use and check and yeah, the symptoms of COVID with staff, and from a technology perspective, the only thing I can think about is this temperature check. So if somebody can share something on this with us, it would be great. Thank you.
All right, thank you, Stephen. I really appreciate that. So we've got just a few minutes left. So let me hit Stephen's question really quickly. I'll tell you what we're doing in California. My bigger plan is to actually conduct another webinar in a couple of weeks, and maybe actually feature this as one of the topic areas, because I think there is some interesting technology out there. In California, what we've done just over the last 10 days is institute the practice of taking the temperature of any staff member coming into the institutions that will have interaction with offenders. So we are taking temperatures with just an infrared handheld thermometer to do it. And we are not taking the temperature of staff members without interactions with the inmate population. Some of that is an agreement we have with labor on entrance and exit into the institutions, trying not to impede, we don't want to have a big line of people and all of a sudden have a problem with social distancing because people are standing in line to get their temperature taken. I am very curious to know if other folks are using some sort of thermal imaging or other technologies beyond essentially a handheld thermometer. So if anybody has any quick input, if you want to type that into the memos box in WebEx, we can address that. But I will put this on the agenda as one of the main topics for next time. In the meantime, we'll do some research and see what people are using. I know the federal government is looking actually at thermal scanners in different instances. So I'll see what we can dig up in the intervening 2 weeks and get that on as a topic. Anybody have any input on that?
We have a link that was sent.
Okay. Doesn't look like, given that I gave everybody no notice on that topic. So let me carry that forward onto the next agenda and see what I can find, and we'll actually conduct part of the session on that. So thank you, Hans and Stephen. I really appreciate you guys jumping on the webinar today. I know it's nighttime over there. So we tried to set it up at a time that was convenient for everybody on this continent, and frankly, I didn't even think about that for folks across the ocean over there. But thank you for the input and the description of what you're doing over there. All right, so elephant in the room conversation. We've had a lot of folks who have been asking about our upcoming summit that is scheduled to start May 31st in St. Louis. May 31st, June 1, 2, and 3, sorry, doing that off the top of my head, are the scheduled dates. At this point, there is no prohibition that goes that far from the federal government. The reality, however, is a lot of us in our jurisdictions have travel bans. I have one. Most of our board is under a travel ban, and we just don't know what's going to happen. The CTA board is still looking at options. At this point, frankly, I would tell you, I think it's probably unlikely that we will hold the current dates in St. Louis. We have not yet actually made a final decision on what to do. We're exploring options, facility, and what other possibilities there are, looking at our schedule going forward. So we believe in the next week to 2 weeks, we will likely be able to post a final decision on what's happening with the summer's conference. But I do think it's fairly safe to say at this point it will not be held on the scheduled dates because of all of the travel restrictions and the number of folks that will not be able to attend. And frankly, we don't need to throw a conference and have nobody in attendance. Would not be a financially viable thing. And obviously, we don't get the benefit of the interaction and the content that we strive for at the summit. So as soon as we know more information, we'll be putting that out through our email links and through the CTA website. but there's still a lot of I's to dot and T's to cross on that particular topic. So I will inform everybody as soon as I can where that stands. So with that said, we're planning to do another one of these webinars. We'll look for 2 weeks out. We already have our first agenda item with the temperature checking and thermal scanning. And in the next 2 weeks, we'll learn as much as we can on that. If you have ideas for other agenda items, please send them to me on the link that's on this slide, president@correctionstech.org. We'll also send out, similar to what we did last time, a quick survey and see what kind of response you get on either topics or what you think worked well, what you think didn't work well on today's webinar. We're looking to make these valuable and constantly improve them, and so any suggestion is welcome. Good, bad, or indifferent, please forward those to us, and we will take those seriously. So let me pause there. Any last questions coming in on the chat box?
And a free app questionnaire to see if somebody has questions. We can post these links.
All right. All right. Thank you, everybody, for jumping on the webinar today. We will close. Thank you to the CTA board for the support in getting this done and helping us create the content, the slide deck, and things along those lines. Thank you, everybody, for taking time out of your day, and we will talk to you again.